Today we are going to talk about balance, the importance of balance for human beings to be able to walk and do our daily tasks. Balance problems are fairly common and often go unrecognized. It's estimated that up to half of the people with elderly population suffer from falls. The fall can be because of loss of balance, or after the falls, the way people try to cope can have a significant amount of impairment in their balance. In the younger people, we can have a variety of reasons why people feel imbalance or actual dizziness, which is also termed as vertigo. There are a lot of conditions which are related to the ear. So we deal with several problems like benign positional vertigo, Meniere's disease, labyrinthitis, vestibular neuronitis, which are related to the ears. Also ear infections, cholesteatomas when they start involving into the balance organs. Balance is a complicated thing, and any sort of disorder related to the inner ears or the central nervous system or the eyes or the joints or peripheral nerves can also give us a feeling of imbalance. We are not able to steady ourselves. People with balance disorders can often land to various specialists. It can be internal medicine, family medicine, neurologists, or ENT. ENT is a common area where people land up with balance problems. Most of the importance goes in the clinical assessment, how we talk, take a detailed history, and the clinical examination. Coming to the more specialized tests, we are proud to inaugurate our balance lab. This balance lab has various specialized equipment which helps us to first identify if there is a genuine problem with the balance, and then localize the problem, whether it is related to the inner ear or it is a central nervous system, or is it because of the joints or not unable to see properly and the visual cues. Once we localize the problem, we can also quantify the problem. How far is it, how advanced is it, and what is the grade of it. Coming to the details of this, we have equipment like video nystagmography, video head impulse test, or rotatory chairs, which actually help us to diagnose inner ear problems, also look after the bilateral problems and also central nervous system related problems. We have a TRV chair, which is a very advanced equipment which helps us to diagnose not just the common causes of benign positional vertigo, and also the more difficult ones to diagnose, which is the horizontal or the anterior ones. The equipment also can position a person through a complete 360 degrees, which helps us to negotiate these particles away and treat these difficult to diagnose and treat positional vertigos. Coming to the more advanced computerized dynamic posturography, this is an advanced equipment which helps us again to see how we cope with our balance. A person can stand and we selectively start isolating the problems. We cut off the visual cues for which helps us to the balance, which tests the integrity of how the balance is able to cope. We also, in the dynamic pulse, it actually creates a moment which helps us to detect how the person's coping mechanism is. This is particularly important for the elderly or post-strokes or people with weaknesses, how we can rehabilitate them. I advise people who are feeling imbalance, not necessarily spinning or vomiting, but still sense of imbalance, who are finding very difficult to cope with this, or undiagnosed problems. You have visited doctors, are not able to find a problem. Please feel free to come to Burjeel Medical City and visit our advanced balance lab, which can identify your problem, localize the problem, and the treatment can be tailored to your needs. We often have a multidisciplinary approach for each patient to see what he needs and how we can cope and how we can be treated. Thank you for joining us.